Improving screenings for alcohol use disorder in primary care. I am Yvette McLaurin. Committee members consist of Dr. Ashton Lindsay, Catherine McCauley School of Nursing, Myrtle E. and Earl E. Walker, College of Health Professions, Maryville University, Dr. Eureka Samuel. So we will discuss the purpose, background, methods, and results. Alcohol use disorder results in chronic diseases. There are over 3 million deaths annually related to excessive alcohol use. It results in disability, and this condition is identifiable. Originally, the center in which the study was conducted was seeking patient-centered medical home, which involves care for the whole person, and treatment as a medical home spot. The purpose was to increase the use of a standardized screening tool that identifies alcohol use disorder, that aids in identifying. And we wanted to identify these patients, refer these patients for modified behavior counseling. This project was a practice improvement project where we used evidence-based practice. It involved the use of the Audit C questionnaire, and it was a retrospective quantitative study. Alcohol use disorder results in mortality and morbidity. It affects various systems within the body. It also increases the burden, economic burden on healthcare. It disrupts family dynamics. And again, it is a modifiable behavior. So we wanted to identify through screening that is also recommended by like the World Health Organization, the National Institute on Alcohol Abuse and Alcoholism, and studies indicate that primary care providers fail to screen patients for alcohol use disorder during those primary care visits. This is very significant in nursing, as nursing involves care for the whole person, and it involves utilizing evidence-based practice when providing care. The patterns of knowing involves identifying and removing obstacles, performing recommended screenings, setting aside those personal beliefs for people who use excessive alcohol, offering empathy with patients who screen positively, and accurate assessment and documentation of those particular screenings. For healthcare, alcohol, again, causes a burden on the healthcare system, and it negatively impacts patients' outcomes. So as nurse practitioners, we're tasked with performing care that exhibits capabilities beyond those convenient extent of a registered nurse. Support was gained from a multidisciplinary team that involved nurses, doctors, administration, front desk staff, and the community member. The benefit was to improve identification of alcohol use disorder, which inadvertently decreases negative costs on healthcare. It can increase revenue for the facility, and once proven sustainable, the facility may be able to seek recognition for alcohol-based treatment facilities. There was tons of research done while performing this project. There was various search engines that were used, and once those search engines were identified and used, there were 10 relevant articles that also contributed to this project. 4 themes were identified: alcohol use disorder, primary care, standardized screening, and substance abuse counseling. Within the research, you wanted to make sure that you didn't have any misconduct, that the public was protected, that it was both legal and ethical to perform. So when looking at this, you need to make sure that you identify those strengths, those weaknesses, and the ones that were identified was randomization, sample size, using a quality care model, consistency, and making sure that it's free from bias. Weaknesses is when you don't have validity and reliability, when you have small sample size, and when there's a lack of variables. Gaps in evidence consisted of no concise answer as to what constitutes brief counseling. Is that 5 minutes? Is that 10 minutes? There was no data to determine which professional who offered the counseling had better outcomes. Was it a clinical counselor? Was it a social worker? Was it a nurse? Was it a medical provider? And which completion method was best? Was it a group session, individual session? Was it a telehealth session? Theoretical framework. There was a change in evidence. So what we're noticing is that sometimes when things change and evidence-based change, there's also a lag in the implementation time. So using Lewin's 1951 change theory that involved unfreeze, change, and refreeze, the project was conducted. Concept and definitions: alcohol use disorder, randomized control trials, standardized screening tool, and validity were all defined to help those individuals who are not familiar with those terms. The DNP project was conducted at a federally qualified health center. Data was extracted from electronic health records of patients 18 to 89 who were seen for wellness or preventive exams. It was a retrospective chart audit. It was conducted at, again, a federally qualified health center that was in a rural community in the southern parts of the United States, and the participants were not engaged. Remember, this was a retrospective chart review, so after the information had been input into the EHR, then the information was extracted. Inclusion criteria was the participants had to be 18 to 89 years of age. They had to be seen from August 22nd of 2023 to October 17th of 2022. They had to be seen for either a prenatal visit or a preventive health exam, a wellness exam, if that's the term you want to use. And the EHR also had to show proof of a documented Audit C questionnaire completed. To be excluded from the project, you had to be younger than 18 or older than 89. You were seen at the clinic for anything other than that prenatal visit or that wellness exam. You had a diagnosis that prevented you from being able to answer those questions that were provided on the Audit C. And you had to have a diagnosis of alcohol use disorder prior to August 22nd. So if any of those things were present, then you were excluded from the study. All information obtained from the electronic health record was de-identified. It was placed on the data collection sheet that was created by the researcher. It was used to track if screening for alcohol use disorder was completed, whether or not a positive screen or a negative screen was identified, if a diagnosis for alcohol use disorder was assigned, and whether or not those individuals were referred for behavior modification counseling. The resources that was needed, that was included in the budget, was staff training, front office staff support, medical assistants and nurses, providers, electronic health records, and the use of papers, pens, fuel for travel, printing of reports, wear and tear of automobile, electricity, internet access, and SPSS for analyzing the data. This is just a breakdown of all the material that was used and the total cost, which that total cost did come to $482.94. The study did protect the human subjects. The data was collected through a retrospective design. All identifiers were removed. The participants were not engaged. The patient list was generated by IT. The list was saved on a password-protected computer, and it was stored in the researcher's locked office. After completion, the list was returned to IT, and then all of the data from this particular study will be destroyed after 3 years. The data analyzed, it used a quantitative retrospective data analysis design. It used a Z-test, which is the difference of two proportion. There was nominal data and descriptive data. The use of chi-square statistical analysis was used, and based on the prior power analysis, the sample size of 154 electronic health records was assessed. The data collection sheet contained information needed to assess outcomes. So we looked at gender with the codes of 1 and 2 for male and female. We also looked at ethnicity, whether or not the screening was completed, the score of the screening, and whether or not referrals were placed. Again, you want to make sure that the study, I wanted to make sure that the study offered that validity and reliability, which the Audit C tool does. It provides evidence-based It's an evidence-based tool that helps with identifying problematic drinking. Those individuals who scored 4 or above and were male were identified as a positive screen. And for females, those who scored 3 and above were identified for a positive screen. There was a pre and post test to assess understanding, and then an educational intervention conducted by the researchers to ensure that the individuals understood what was the importance of screening for alcohol use disorder, how to administer the questionnaire for the audit C, and how to record the score. So again, it was confidentially protected. The approval was obtained from the IRB, non-human subject research. Minimal data was extracted. There was no violation with HIPAA, and there was access to the EHR through the researcher's own password. When we look at the data, pre-implementation, male accounted for 6%, which was 9 individuals, and female accounted for 94%, which was 136 individuals. And post-implementation, there were 37 male, which was 24%, and 76% female, which was 117 individuals. Pre-implementation for race, Hispanic accounted for 24%, which was 35 individuals. Caucasian was 2%, which was 3 individuals. And African Americans were 74%, which was 109 individuals. Post-implementation, there were 112 African Americans, 73%. Caucasian was 7% at 11 people. And then Hispanic was 20% at 31 individuals. So I used chi-square statistical analysis with an effect size of 0.05. We answered the questions about comparison and differences, and then the use of the TLZ test, which is the difference of 2 proportion, looked at screenings for alcohol use disorder, positive screens identified, referrals placed. So there was 2 collection points. Pre-collection point was July 20th. 2022 to August 15th, 2022, and then post-collection point was August 16th, 2022, and 10/17/2022. The steps and intervention are all displayed from August the 20th to December 10th of 21. There was a needs assessment, collaboration with leadership on the design. From May of 2022 to August 18th of 2022, the Maryville IRB approval process was completed and then approved. From August 18th of 2022 to August 21st of 2022, the scholar met with the study site and IT, and then there was a retrieval of the sample list from IT. From August 22nd of 2022 to October the 17th of 2022, the EMR was reviewed, data was collected, data was coded. And then from October 17th of 2022 to January 31st of 2023, there was an analysis of the data and production of the results of the project. So contextual elements and interaction, education on the process for administering Audit C questionnaire was provided. Of course, there was reluctancy from staff. There was language barriers when identified when administering the Audit C questionnaire. The language barriers was taken care of by using the language line or those staff members who were bilingual and trained in translation. The staff initially lacked motivation to the change. Most of them expressed concern about having an already overwhelmed work day and felt that this would add more time to their work. But most of this was overcome by educating the staff on the importance of screening for alcohol use disorder and the importance of using the Audit C tool, how to administer it, how to code it. As we looked at the observation, pre-implementation, there were 119 females who had the opportunity to be screened, but only 1 was screened. For male, there were 26 and 1 was screened. For post-implementation, for females, there was 117 opportunities and all 117 were screened. And for male, there were 37 potential opportunities and all 37 were screened. The observation as far as the pre and post training results, there were 23 employees prior to the training, the educational training, only 1 passed the exam. And then After the educational training, the same 23 employees were retested and 20 of those passed. So as we analyze the patients who were screened, the p-value of 0.0068, which is less than the significance level of 0.05. So there was significant information to suggest an increase in the ratio from pre to post intervention. Okay. Also, when we looked at the analysis of those patients who were referred once the positive screen was identified, the p-value was less than 0.002, which the p-value less than 0.002, which is less than the significance level of 0.05. Again, it showed that there was a significant information to suggest an increase in the ratio from pre to post intervention. And then we looked at the pre and post educational survey. So we wanted to see if once we educated and trained the staff, was there an increase in knowledge? And again, there was a p-value less than 0.0001. And that also was less than the significance value of 0.05, which suggests an increase from the pre and post interventional learning information. There were some unintended consequences. Because this site was a federally qualified health center and the training was conducted during the annual staff meeting, each one of these sites had to be open in case the patient walked in. So those individuals who had to stay back at their original site and not attend the annual training were trained at a different session. So there was some question as to whether or not the information presented in the first training session was also presented in the same fashion in the second training session. There was question about whether or not the questions that were asked in the first training session were communicated to the staff in the second training session and vice versa. There was no missing data. So when we look at the findings, we noted that there was an improvement in the number of patients screened, the number of identified positive screens, and the number of patients referred for substance abuse counseling. This all aligns with the theory of minimal intervention at primary care provider's office could help to identify patients with alcohol use disorder. This also aligns with the recommendations by the World Health Organization, the National Institute of Alcohol Abuse and Alcoholism, and the U.S. Preventive Service Task. And again, it shows that continued education helps to utilize evidence-based guidelines or implement the use of evidence-based guidelines. The strengths of the project was that it was a retrospective design, which is ideal for evaluating effectiveness. Staff training offered them with written literature and the chance to ask questions. It's an open forum, so the people who had questions were able to discuss their findings or discuss, what the question was, and the trainer was able to answer those questions, and then it benefited the other staff members who were there because they were able to hear those questions and understand the reason and the answering. It also utilized a pre and post test, which studies show that utilizing a pre and post test with the same questions help better to recall information, and learning occurs at a higher level. Project limitation was the accuracy of answers that was recorded. There was no true way to determine if the answers that were recorded in the EHR was actually those answers of the individual. We as healthcare providers are obligated to record true and factual information into the electronic health records, but there was no way to really assess whether or not that occurred. And then there was no way to assess the outcome of the behavior modification counseling, whether or not it was a success, whether or not it took a certain number of visits to reach a reduction in alcohol consumption for the patient, or which type of counseling method was better. So, this study was intended for primary care providers. However, it may also be beneficial to any other provider that provide chronic and acute care. But not all acute care services may benefit from this, meaning that those individuals who present to the ER with life-threatening injuries, this is not something that you want to take the time to do. You want to save the patient right then and then put this on the back burner. So there is a situation that not all providers may benefit from screening for alcohol use disorder. This project is sustainable. Continue screening at or above the post-intervention level. Continue training at annual mandatory staff meetings can help it be sustainable. And then this project offered minimal financial burden to the facility, which also makes it positive for sustainability. So the organization and the leadership structure help to facilitate the project. The clinical services director also helped. And then the fact that the organization's health informatics and infrastructure had this Audit C2 embedded into the computer and you were able to retrieve the information also helped to facilitate the project. The interpretation is that the results align with other studies and that show screening for alcohol use disorder in primary care was attainable and that it helped to identify those with excessive alcohol use. And again, other organizations like the World Health Organization, the National Institute of Alcohol Abuse and Alcoholism also suggest that these screenings should be done in primary care. And then an increase in screening leads to a progress in care that leads to better outcomes. So clinical practice and future research, again, the project did identify gaps in routine screening. It showed that continued education and adherence contribute to best outcomes. And then more time is needed to determine, again, the effectiveness of those counseling sessions. So with healthcare policy, the study validates the needs for educational programs that improve screenings. It identified the need for change to occur and advocate for healthcare policy changes. The goal of healthcare is to provide safe, high-quality healthcare that reduces disparities. The project support evidence and delivery of screening for excessive alcohol consumption. The project supports an increased screening for alcohol use disorder in primary care through educational intervention. The results show that it is obtainable and vital, that early identification, early treatment, and behavior modification that results in the decrease in the overall consumption. And this can lead to better health outcomes, but still there's more research that's needed. I have included references that you can review at your leisure. Thank you.